Well, welcome back to another episode of ResearchWorks. It's that time of the week again, and we are very excited for you to join us today.
Yes, welcome back, everyone. Today we are welcoming back a guest as well. A throwback right back to our very first season. In fact, I think it was one of our most popular episodes and still is one of our most popular episodes to date. Mm-hmm. So welcome back, Professor Iona Novak.
Thank you.
It's so great to have you back. And, you know, you do probably get this all the time, but I just have to say, like, your work has been so influential in our field. I don't think there's a day that goes by where I don't talk to a family or another clinician about the work that you've been behind. And that really speaks to the value of everything that you've invested your time into, because we know how much time it takes. Well, we've got a glimpse of it. It's probably so much more behind the scenes. But, you know, communicating it is equally as important. I know that's something you're really passionate about too. It's really cool.
It sure is.
So today we're going to be talking about a bit of a review that you put into expert review of neurotherapeutics in 2023. And it really piqued my interest because it's something that, again, we're talking about a lot and I don't feel like we have a lot of knowledge about it. So get ready. The title will be something that you really want to be into. So it is called The Potential of Cell Therapies for Cerebral Palsy. Where are we today? And yeah, I want to know the answer to that.
So do I. And Iona's going to guide us through that and our listeners through that.
Indeed. We have a lot of questions.
Yeah. But before we do that, Iona, we will refresh our listeners' memories with a little bit of a bio about you and the impressive body of work and accomplishments that you hold. So Professor Iona Novak is a Fulbright scholar focused on conducting a research program of neuroprotective, neuroregenerative and neurorehabilitative clinical trials in cerebral palsy. She is a Cerebral Palsy Alliance Chair of Allied Health and co-founder of the Cerebral Palsy Alliance Research Institute, which is affiliated with the Brain and Mind Centre and Faculty of Medicine and Health at University of Sydney. She has a significant track record in generating and translating new cerebral palsy intervention knowledge. Professor Novak is recognised as an international expert in rehabilitation and neuroplasticity for children with cerebral palsy, and she is the invited chair of the International Clinical Guidelines for Cerebral Palsy. She holds multiple competitive grants, including Centres of Excellence, clinical trials, cohort studies and translational studies for stem cells. Recently, Iona was recognised in the King's Birthday Honours for advances in cerebral palsy.
Wow. Congratulations on all of that, Iona. I know when I saw that on social media, you being on the list, I was very excited for you.
Thank you. I was incredibly humbled. It's certainly a big team effort and we do this work for families. So it's wonderful for them to be recognised.
No, that's absolutely true.
Yeah, such a great reminder. So Iona, that's the formal and very impressive getting to know you part of the podcast, but we like to do an informal getting to know you as well. So that's with our icebreaker question, which today is, what's one thing that you have to do every day that you dislike or wish you didn't have to do?
It's getting out of bed. I am not a morning person at all. I'm really a night owl. If left to my own devices, I'd start work at about 3 p.m. in the afternoon and go all night, you know, so I'm not a morning soul, but so I live in an office, so, you know, it is what it is.
Oh, gosh, I love that.
Yeah, I'm always so amazed by people whose brains work better in the afternoon and at night time, because I think my answer is probably the complete opposite to yours. I really dislike that period of time when you know it's time to go to bed and you have to get up off the couch and brush your teeth and like do all the things to get ready for bed. Or just once I've decided that I'm ready to go to sleep, I just want to be there.
Yes, that's right. All those things that your parents taught you, things you need to do. Is that the thing? Is that your answer or is there something else?
No, I think that's
your thing?
That's my answer. Yeah, that period of time between deciding you're going to sleep and then actually going to sleep. All the things you have to do.
All the things you have to do.
Yeah.
Well, how do you like this question? Because it does make you reflect a lot on your life. And for me, I made a really terrible decision probably a good 8 years ago now, where I was just getting my kitchen redone. I've got a very small house And at the time, the person who was doing my kitchen said, "Oh, do you want to make space for a dishwasher?" And I've never really had a dishwasher before. And because there wasn't much space, I said, "Oh, no. It's fine because I need my cupboard space." I've regretted that ever since then. And I've, lived in places, I've house sat for people who've got dishwashers, and I love it, and I come back and I'm so disappointed with life. And I know it's a first world problem, but I have to hand wash my dishes, and I don't really want to do it anymore.
Yeah. Nobody told you that the dishwasher is a cupboard.
Indeed. Exactly.
Spot on.
It was the worst decision. I regret it every day.
Yeah.
So anyway.
I love that philosophy. The dishwasher is a cupboard. I'm going to share that with my husband when I get home.
We have a lot of dishwasher jokes at our house. My husband is the self-proclaimed Scandinavian architect with stacking it, and I'm a raccoon on meth is my title because I believe everything can fit in there.
And I've heard a lot that those two kind of polar opposites of people always find each other, and they end up sharing a house and a dishwasher. So
there we go, the good old dishwasher.
Yeah. Well, thank you. That was very insightful, both of you.
I will not cut Iona in the morning.
No.
That I will know.
We all know that now. That's very good. Write that down.
I will write that down, yeah.
All right. So some more insight now, jumping into this paper,
Let's go.
We're so thrilled to be talking to you about, Iona. In the very first paragraph, I really loved how you said that this article set out to critically evaluate whether there is hope beyond the hype for cell therapies. So to start with, can we just talk about some of that hype? What's it all about?
Yeah, I think stem cells is a topic that has really had a lot of science hype, and science hype's a great term, was sort of coined by a Canadian ethicist. And I think the public really got on to the hope of stem cells maybe a long time before clinicians. And it's really because stem cells offer us this possibility of curing incurable diseases. And, that has to be a breakthrough as a concept in itself. And I often talk about it as an absolute revolution in medicine and healthcare. And it's said that maybe as many as 1 in 3 of us might benefit from stem cell therapies at some point going forwards. And that's partly because we're all aging, whether we want to be or not. I think I would have made a good Gen Z person who didn't want to get out of bed, but I'm way too old for that. I'm going to need stem cells before you know it. But it's also been popularized by important people in the media. So if we think, back to Christopher Reeve, an actor who was Superman and had a tragic spinal cord injury, and was on the forefront of advocating for governments, including Australian governments, to fund stem cell research to look for a cure for spinal cord injury. And I know he was very influential on me. And Michael J. Fox, who has Parkinson's disease, has spent a lot of time and money raising money to fund stem cell research. And heck, Kim Kardashian, I remember one day, and the minute the Kardashians have had something to do with it, it gets done, right? So I remember in my newsfeed one day, she had a vegan stem cell facial. And I'm thinking, stem cells come from humans. I'm not even sure how it's possible for them to be vegan, but anyway.
Don't ask too many
maybe the donor was vegan.
Interesting.
But nevertheless, they've been really popularized. But I think what I really wanted to get at in this article is that despite this really intense hype that has come, science hype and hope from patients, we really are making a lot of progress. And that's really what I wanted to unpack for people. What is truth beyond advertising?
Yeah. What is actually possible? Yeah.
Absolutely. And I think, you have to watch sci-fi movies, and when you get some movie stars behind it, it's in our sort of pop culture, I suppose. And I guess from there, as a clinician, it's really difficult to wade through, what is still this futuristic science that we're really hopeful for, and what's actually present and what's here. So I'd love you to walk us through what cell therapy actually even is, and bringing it back to people's cerebral palsy. How does that even work, and what's the concept behind it?
Yeah. So starting at the beginning is a good place. So what makes a
Great.
stem cell different to any other stem cell or any other
Yeah.
cell in our body?
Yeah.
And I guess the definition of a stem cell is that it can do two special things. So the first one is a term we call self-renew, and that's simply to make copies of itself. So probably every day, most of your listeners on their computer do the function copy and paste, and they're making an exact copy. And that's one of the things stem cells can do. They can make an exact copy of themselves. The other property that they have is something we call differentiate. And that basically, in plain English, is to choose a career. So all stem cells start out in an embryonic state, and they can make any kind of tissue, any kind of bone, any kind of organ, but eventually they choose a career. And so maybe they choose to be blood cells. Maybe they choose to be heart cells, cardiac cells. Maybe they choose to be brain cells, so neural stem cells, the cells that can make the three kinds of cells in our brain. And once they've chosen a career, a little bit like us, it's pretty unlikely that you reverse out of that. It can be done.
Yes.
You know, the winner of the 2012 Nobel Prize actually worked out how to re-engineer. If you've chosen a career in medicine and you want to be a plumber because you make more money, to re-engineer you back to that embryonic state and then drive you back up into a different type of cell. So once a cell's chosen a job, we call it an adult stem cell because it's got a job, it's grown up now, and it's doing one thing. But before that, they're in an embryonic state. And so we can transfer something from an adult stem cell back to embryonic and back up to a different, so we can make skin cells back to embryonic and then up into brain cells if we want to. It's a complex process, but it's possible. So I think, and this important innovation came about to really get around the moral and ethical complications that are thought about with stem cells. Most people feel pretty comfortable with the idea of donating organs, donating blood, and so therefore donating adult stem cells. But once you start talking about embryonic tissue, it's a much more grey area that we should have important questions and complexities about. But these iPS cells, which we can reverse engineer from skin back to brain, they get around that problem. So we've got a lot of solutions now in stem cell. So, you know, what does that all mean for cerebral palsy was your question. And there are lots of different kinds of stem cells in our body. Like while we're taking this podcast, we're probably making some in our knees right now, which, you know, where we renew certain cells all the time. But the sort of four cells we've been thinking about for cerebral palsy, the first one's called umbilical cord blood. And so as the title says, it comes from the umbilical cord. So that tissue is usually discarded by most people. It's the connection between the mother and the baby, and it does have some blood left over in it. And that can be, after the baby's born, that blood can be drawn out and frozen and stored as a treatment source. It's a really important cell because the mother is assisting the baby to go from embryonic state to become a newborn human. That's a really magical and incredible scientific process. So it unsurprisingly includes a whole range. It's a mixed stem cell source. It's not just blood, it's a range of stem cells. So it has some pretty unique properties, and because it's fairly easy to obtain, it doesn't cost anything to obtain it. Most people have it, they're going to throw it away, you can store it. It's a fairly uncomplicated and easy source of cells to obtain. So it's been the most studied, and we have a transplant for people with a blood cancer that's been available and approved for 50 years using umbilical cord. So it's a pretty well-known cell, but that's one we think a lot about for cerebral palsy because you can use a sibling's cord blood, and more recently we've been able to show it's very safe to use a donor's cord blood as well, which is terrific for people with cerebral palsy, because originally we sort of thought about it as it'd be great to be using your own cord blood so there's no rejection issues. But most people don't know they're going to have cerebral palsy before they're born. There's no pre-birth test. And so it was quite a complication of the feasibility of that approach. But now we know we can use donor cord blood. So it's a pretty well-researched concept. We know it's incredibly safe, and it's a relatively simple process. to use. So the next one we would think about is mesenchymal stem cells. So they're stem cells that operate in our fat tissues, in our joint tissues, in our connective tissue. The really nice thing about those cells is they have a special quality called immune privileged. So if you were to have a heart transplant from someone else, it's someone else's heart, and so you have to take an anti-rejection drug so you don't reject that transplant. When a cell is immune privileged, it means I could have your cells, you could have mine, and we won't reject them. The body knows how to handle that. It's almost like they're like an O positive blood, you know, they're like a universal donor in some ways. And so they've also been really well researched, because those are cells, therefore, that you can replicate in manufacturing, and you can have them readily available. If you imagine you need an emergency treatment, you don't want to be waiting for a baby to be born to get the umbilical cord blood to get the treatment, right? You actually want something that's there in the hospital off the shelf. And that's one of the important properties of mesenchymal stem cells and why they're so widely used, and we think about them for cerebral palsy as well.
Wow.
Another cell that we think about is something called HSCs, or hematopoietic bone marrow mononucleated cells. There's a big mouthful there. There's no test at the end of this. People will have heard about bone marrow transplants, and those are the cells that we have in our long bones, our femurs, inside of our thigh. And that can be harvested. So we know in a bone marrow transplant, you can donate your bone marrow from one person to another. In a case of cerebral palsy, you can harvest the person's own by giving them a hyperstimulation treatment beforehand, so they make more bone marrow, and then you can, with a needle, draw that product out and then reinfuse it so that you have more of it. And then the one that we think about particularly for cerebral palsy is called neural stem cells, and those are brain stem cells. And obviously we're talking about a brain injury or a brain abnormality, so it makes a lot of sense if you want to think about those cells. Neural stem cells make the 3 building blocks that we have in our brain, and there's 3 different types of cells that we have there, and the neural cells can make all of those. So I think if I go back to adult cells that have chosen a job versus, cells that haven't yet chosen a job, if we think about blood from cord blood, tissue from joints, and bone marrow, all of those are circulatory types of products. They're going to help with things like inflammation, but they're not related to a brain, right? So they're going to have a treatment effect. Whereas if you were thinking about a cure for a condition that involves the brain, you're really going to need brain cells. And that's where we think about neural stem cells. So all 4 of those cells can be really helpful for people with cerebral palsy, but 3 of them are a treatment and 1 of them is a potential cure. And that's a good way to think about them because they have really different jobs. They've chosen different careers.
Yeah.
Oh, I loved how you described that. I've learned so much in that.
So beautiful. Yeah,
that was good.
So beautiful.
Yeah.
And so, Iona, with the neural stem cells, do we have a sense of, how, I'm going to butcher this, how transferable they are? Like, do they have to be a match to be able to be, utilised by someone with cerebral palsy? Or is there a process that they go through to work out the right neural stem cells to use?
That's an excellent question, really important, because you're picking up on a few issues. So we first of all start with, I could donate blood without an injury to me. I can donate a kidney. It's a bit more complex, but I'm going to live through that. But if I start donating brain cells, then I'm going to have a brain injury, right? So it's quite complicated. So we have to source those cells from either a baby that's passed away. And so we work commonly with a company that has a family that donated all of their child's who passed away, their organs, including the brain, and we have brain cells from there. And they've been manufactured for over 20 years and used in clinical trials, just the single donor. Or the other place that people talk about them coming from is embryonic sources. And I won't go too far into that, but you can get them from those sources as well. So first of all, they have to come from a donor, and they have to come from a donor that's not going to get injured, because do no harm to the patient is also do no harm to the donor. So that's step number 1. In terms of matching, you don't really need to match them too much. But the thing we think about with it's a little bit like a heart transplant. You're going to reject that cell. If you give someone else's brain cells, your immune system automatically goes, hey, hang on, there's a visitor here. This person doesn't belong. A bit like on Sesame Street, one of these things is not like the other one. And the brain certainly works out, and the immune system hypes up and will clear the cells. So actually just you will absorb them and get rid of them. So if you're wanting to cure a brain injury, a bit like if you're having a heart transplant, you don't want the heart there for 5 minutes. You want it to stay and do its job. If you're wanting to cure a brain injury, you're wanting these cells to repair and to stay, you have to also give an anti-rejection drug with those cells so that the body doesn't actually reject them and is capable of making new brain cells from these stem cells that you've taken from a donor. So that's the one cell that we think about anti-rejection drugs for cerebral palsy. The other cells, we don't really need to use anti-rejection drugs because it's a treatment effect. We're okay that it's transient, that the body works out and it's going to clear the cells. But while it's in there, it's doing a job. It's helping the body, and then you will clear the cells. And so it's a temporary effect.
So following from that, then I guess it's a good time to talk about how they're actually administered, because I feel like that's sort of part of the process of what you just described. Yeah. So the neural stem cells, how would they be administered?
Yeah, so neural stem cells, first of all, they're not good travelers. I am a good traveler. I can get most of my life into an overhead cabin baggage bag in a plane. I believe in no luggage, but and I can go anywhere. But stem cells really don't like to travel. So if it's a blood stem cell, it's used to circulating. That's part of its job that it's in career it's chosen. But brain stem cells are supposed to stay in the brain, and so they don't move. And so two things we've learned from human studies is that if you put them in a drip in the blood system, they just don't make it into the brain. We all have a fence around our brain which keeps infection out. It's called the blood-brain barrier, and it also will keep cells out. If you try putting them in a drip, for example. So that means you have to, in this case, what we call transplant them. So you actually have to have a needle-guided process. There's a very careful process that's used widely in Parkinson's disease for treatment. So the process that is used is like several brain scans, and they build a virtual model of your brain and can test the surgery. And using a stereotactic technique where they place a needle through into the brain, they can within 1 millimeter exactly locate where they want to do that. And they do this in Parkinson's for delivering deep brain stimulation, for example, all the time. So this has been done in children in preparation for treating children with cerebral palsy. Neurosurgeons can make this placement within 1 millimeter of where we want it to go. So actually the big risk from stem cells, neural stem cells, it sounds scary. You're going to have brain surgery, and it is a little bit scary, but these surgeons are very, very good at their job. The actual biggest risk of those is the anti-rejection drugs, because anti-rejection drugs leave you open to other infections and things like that. So interestingly, while most people would fear the neurosurgical process, actually the more complicated part is being on anti-rejection drugs. And we've seen in trials of children with fatal diseases of childhood like Batten's disease, where there's been preparation for working with children with cerebral palsy, no surgical complications, no complications from the cells, just complications from anti-rejection drugs, which we know a lot about, and transplant specialists can manage those very well.
And Iona, are there particular categories of brain injury that respond better to the stem cell therapy than others? Like I'm thinking about, we've spoken to people previously about the timing of the brain injury and how that presents slightly differently, HIE versus other types. Yeah. Do any of them respond better to stem cells than others? Do we know that yet?
No, we don't know that yet. We suspect there may be a process, but we've never had enough data to look at that. One of the strengths and the limitations of the stem cell field in cerebral palsy is really that they have treated all types of cerebral palsy. So
Okay.
we know it's safe in all
Yep.
kinds of cerebral
Yep.
palsy. But the question you're getting is, who does it work best for? And we've not really had enough data to actually unpack that backwards to see whether it is better for some types of injury rather than others. We do think if you're using a cell that has very strong anti-inflammatory properties and you've got a new injury like HIE, hypoxic ischemic encephalopathy, as you just described, or a stroke that would have a lot of inflammation associated with the brain injury, then using an anti-inflammatory cell very quickly and early, and that would make a lot of sense, right? Whereas if you've got a chronic injury, it's an old brain injury, you function and you have your whole way of working, that's where maybe a neural stem cell might come into play. So the age of this, the person and the type of cell and the process is somewhat related to what you're trying to do, what treatment effect you're after, and what kind of cell that you're actually going to use.
The very intricate puzzle that you're trying to piece together, isn't it?
To pack apart. But one thing that we have found recently and been able to demonstrate in a meta-analysis is that people with cerebral palsy have prolonged inflammation. So we tend to talk about 80% of people's cerebral palsy occurs during the pregnancy. And so we think of it as an old brain injury. If you're talking about even a 4-year-old, it's a 4-year-old brain injury, right? And it's interesting, however, we've discovered very recently that this inflammation is not just a week, like people originally sort of described in the literature. We're seeing in 4-year-olds and in older children persistent inflammation. It's in the brain and it's in the whole body. And this really gives us a very important and new treatment target in cerebral palsy. We talk a lot about muscle treatments because muscles function differently. We talk a lot about brain treatments. We talk a lot about, training treatments to work on your mental health, for example. But we haven't really talked about anti-inflammatory treatments in cerebral palsy. It's a pretty new space. I mean, I think a lot of your listeners would be very familiar with things like anti-inflammatory diets, thinking about autoimmune diseases or thinking about cancer. And we now know that this same reactive inflammation is occurring in people with cerebral palsy. And there's probably this raft of new treatments available, and we need to think quickly about with anti-inflammatory. And cells, one of the jobs that they do is anti-inflammation. So umbilical cord blood, probably the reason it works is a very strong anti-inflammatory properties. Mesenchymal stem cells also have very strong anti-inflammatory properties. And so I think this is really a new treatment target for cerebral palsy, and probably explains why some things work longer than others, depending on how much inflammation the person has on the cause of their cerebral palsy and how much inflammation, anti-inflammatory properties that the cell actually has to work with.
So what I find so interesting from that is, I guess, there's so much hope there. I think a lot of the time when you talk about stem cells, a lot of people think about those maybe first few years. If you're lucky, maybe for 2 years, you might be pushing it a bit in terms of being available. But now we're sort of saying, actually, if you're a little bit older, like there still could be an impact that this could have for them. Have there been any studies that have shown changes like in actual brain structure or connectivity, or are we really seeing more functional impacts, in terms of gross motor function? Like what are we sort of seeing there in terms of, does it work,
Yeah. So we can see when we look at all the stem cell studies that have been done in people with cerebral palsy, and over 2,400 people now have been treated in clinical trials for cerebral palsy. So that's more than most of the drugs that are commonly used in cerebral palsy, more than most of the rehabilitation techniques, actually. We categorically see that stem cells produce an improvement in movement, and the size of the treatment effect, we call them effect sizes as a researcher, but it's basically how much does it work? It works more than rehabilitation alone. And that's an interesting sentence for me to say out loud. Like I trained in rehabilitation. But I think it's a really important finding to say out loud. It's not an either or. They probably have an interaction effect. So using rehabilitation to train, because going to your point about do these cells change brain structure, they certainly change function. They change movement function. And we've seen in some studies from the Duke group in the United States, changes in brain structure as well. But a brain structure change is no good to you if it doesn't translate to function, right? What we were mostly interested in all these trials is, does it improve movement? Because that's a common problem amongst people with cerebral palsy. And it definitely does that, particularly umbilical cord blood. So, it has a reasonable effect size. It can change brain structures as well. But what we're really looking for, of course, is treatment outcomes that matter to people with cerebral palsy.
Yeah.
And I do think there'll be an interaction effect that if you change a brain structure, so let's say you've got a habit, it's really hard to fade a habit. If you've got a habitual way of moving and you build a new circuit in the brain with cells, then in order to learn to use that circuit, rehabilitation is the best known treatment for actually learning to do that. So there is going to be this, a little bit like how we have Botox or botulinum toxin and rehab, and when they're combined, you get the best results. I think that's what we're going to see with stem cells as well, because if one changes structure and function in the brain, you can learn to move better with that structure and function. So a combination with rehabilitation.
That makes good sense.
It does,
to me.
doesn't it?
Like in my very crude level of understanding, introducing these cells into the brain isn't enough. You then have to kind of teach them the right way
task
to
specificity element of it, right? You still need to, you can't magically drive a car if you haven't done it before. You still need to probably do it
Show
at
them
some
the
point.
way.
You probably still need to know how to do that.
Yeah.
I'm really curious about the mechanism. What's the thoughts about the mechanism that is resulting in these, gross motor changes, for example?
Yeah. So stem cells, all kinds, can do one or many of these three things, but they all have three possible mechanisms they can work by. So the first is anti-inflammatory, which we've talked a little bit about. Inflammation is great when you first have an injury. So if you had a cut on your arm, it gets all red, that's inflammation healing. But if it's unchecked and it's persistent and long term, then it becomes a really big problem. So anti-inflammatory, they do that job. The second job they do, they can repair tissue. So in terms of a brain injury, that's why we're particularly interested in neural stem cells, because the only ones that are going to repair brain tissue are brain tissue, right? Whereas the blood tissue or the blood stem cells can actually assist with the anti-inflammatory process, which can still be helpful.
Yes.
And then the third job they do is something called trophic effects. So I kind of describe that to people a little bit like Hugh Jackman effect. If Hugh Jackman sort of came into the podcast now, we'd all do something different. We'd stop talking about this topic. We'd ask for a selfie. We'd kind of have a chat. Everything would change, right? Our behavior would change. Maybe our smiles would change. Exactly. And stem cells have this sort of Hugh Jackman effect in that they can have a trophic effect in the brain. So if you put a blood stem cell like umbilical cord into the brain via a drip, it will drive down inflammation, but it will also have a trophic effect. So it might trigger the brain to grow new blood vessels, for example. So if you've got an injury that's not getting good blood supply, it might produce more blood supply to the area, which assists with natural healing. So it's not actually making blood cells, but it's doing good things around the injury that also assist natural repair processes. So anti-inflammatory, repair, and trophic are the three things that they do. So some stem cells can do all of them, and some cells only do one of those or a combo. And that's why when we say not only is cerebral palsy not just one condition, stem cells is not just one treatment either. It depends on what cell you're using and what you're trying to get it to do. So if you want a blood cell in a person with a blood cancer, it can have a cure. If you put a blood cell into a person with cerebral palsy, it's a brain injury, it can help the environment with the trophic effectors, help the anti-inflammation, but it's not going to make new brain cells. You need a brain cell to do that. So again, it comes down to which cell are you choosing and what condition are you trying to treat. But all of these properties can be incredibly helpful. And as I mentioned before, this inflammation feature of cerebral palsy, which all cells really have an anti-inflammatory component to them, is what we think is a fairly
you talk
simple explanation of why
Oh, no, that was
umbilical cord
brilliant.
blood might be working.
Yeah, it's really
yeah.
interesting. And as you're talking about that, Iona, I was thinking about how much as a physio we talk about muscle, and we don't really know why. You know, there's always I've been on these panels for conferences. They're thinking about muscle. You know, is the muscle smaller because it was always going to be smaller as the neural drive? Is it because it's disuse and you have disuse atrophy? And it'd be interesting just to think the role of stem cells even in that context and actual muscle. And if you can build better efficiency in muscle contractions, then of course function will be improved as well. Like it does get you thinking about a lot of things, is all I'm saying.
Yeah,
and my brain
absolutely.
is tingling with that.
Yeah,
Yes.
all the downstream effects. Yeah.
Definitely. Yeah, and there are muscle stem cells. They're called satellite stem cells. And
Yes.
of course, in a disease, again, back to the same point, so muscular dystrophy, they're using satellite stem cells. It's a muscle disease. In cerebral palsy, would a satellite stem cell for a muscle help? It's probably going to have a treatment effect, but would it be a cure? Probably not, because the cause of the muscle problem is a central problem. It's coming from the brain. So again, cells can have different actions and outcomes in different conditions because of what kind of careers they've chosen.
Yeah.
Yeah. Oh, that's so good.
It is. Iona, you know, I feel like, well, I certainly have a much better understanding of stem cells and how they work and when they might work and under what conditions now. But can we talk logistics for a second and how children and families actually access stem cell therapy? How does that work?
Yeah, and this is the part of the talk I always hate, because despite 15 years of great research, there is no country in the world that has an approved stem cell treatment for cerebral palsy yet.
Wow.
There are approved stem cells for blood cancers and for skin conditions and for burns, for example, but not yet for cerebral palsy. But we are incredibly close. I think we will see in the next 1 or 2 years, the United States are working very closely with the Food and Drug Administration for the final trial on the end. We call it a pivotal trial to get a regulatory approval for umbilical cord blood. So I would expect in the next few years you will see an approval in the United States for umbilical cord blood. And that's certainly something we're also working on via a different process in Australia because the data is in, they're safe. They improve movement. And if you think about it from a parent's point of view, I mean, you might need 30 to 90 hours of rehabilitation to improve movement. If you get the same or a slightly bigger result from a 20-minute blood infusion, then it's a lot less time out of your childhood. It's, you know, okay, maybe it's a little bit scary. It's a hospital visit. But, you know, in terms of the burden on families and the time commitment, it's worth it. Even if it's transient, that's going to be worth it to families. So the data's in. We're just going to go ahead and take the next step and get a regulatory and funding approval in Australia. But I think that's really right around the corner.
Wow.
So how do families access them? Right now in Australia, there isn't any way to access them. People could join a clinical trial. There isn't one open currently in Australia. There are some. People could look on clinicaltrials.gov and look for them overseas. But of course, that would be the way we'd most recommend if you were thinking about it, get into a clinical trial where you're going to get monitored and have your safety considered so that it is do no harm and it is about benefit for you. But of course, people can buy stem cells as well. And just a little bit like lots of rehabilitation treatments are sold with no research behind them, there are many companies around the world that sell stem cells to families, including families with cerebral palsy. Those kind of companies are not legally allowed to operate in Australia, so they're not available here. And this is why we call it something called stem cell tourism. So you have to actually go overseas to buy these cells because we have a great government that doesn't allow that type of unregulated market in Australia. But stem cell tourism, there are places you can buy umbilical cord blood overseas. You can buy all sorts of other cells as well. And of course, that's always an agony for families. If younger is better, and there's no approved process here in Australia, is my child missing out? And it's a very complex set of questions that parents weigh up and agonize about. If you've got people listening to this podcast and you're wondering if you should go down that line, I'd encourage you to read a booklet. It's called The Patient Handbook from Stem Cells Australia. And it's got a nice series of checklists that are very open-ended for you to ask a company if you were thinking about buying them. So first of all, a good question is, are the cells human? Because even though they're stem cells, you can get stem cells from lots of places. And in the early days, there were very unscrupulous companies selling animal cells to humans that had catastrophic effects. So some very sensible questions like that can walk through. Will you monitor my child's safety? In questions to ask, for example, if you go overseas for treatment, you're no longer Medicare eligible. Is that a financial consideration for you? So just a series of practical, open-minded questions like that if it's something that people are thinking about.
That's such a helpful
But hopefully
resource.
we will get an approved treatment in Australia. I think we've got some really new data that has shown it was a collaborative project worldwide where we aggregated every case of someone with cerebral palsy that had umbilical cord blood, and we were clearly able to show that under 4 years of age, people had a large treatment effect, almost twice the size that they had from rehabilitation. And it worked best in children, what we call GMFCS 1 to 3, so children that were on a pathway towards walking. What we don't know, because we could also see in those curves that there was a dose effect, that we started out at low doses in the field, being conservative and not wanting to cause harm, but we can clearly see that the higher the dose, the bigger the result, and we really haven't pushed this continuum as far as it might go with people with cerebral palsy. So I think there still is hope for people with more severe physical disabilities. Either changing cell lines or using higher doses would also be important next steps for them as well.
Gosh, that is incredibly exciting. And look, my next question, I don't know if it'll come out the right way, so let's just give it a go. But every now and then, whenever something new and exciting comes about, it's inevitable that there's resistance on the other side, kind of going, what are you doing? Cerebral palsy is a lifelong, permanent, like what's happening? And I think I've heard that from time to time. I don't know what source, but you hear those rumblings. What would you say to people who are sort of putting out that caution despite some of the results that you're seeing, Iona? I think it's an important thing to talk about, right?
It is. I'm no stranger to politics, actually. So I'm a person that really loves truth, and I try to wear a patient hat when I think about these things and put aside what I know, what's my favorite intervention, what I was trained in, and think about what is the data telling me is the best thing for patients? Because in our heart as clinicians, that's what we want, is the best outcomes for families. And I think this surprises a lot of clinicians. First of all, how much work's been done, that 2,400 people have been treated with no safety problems and some reasonable efficacy as well, and that it is effective. And we all probably guarded ourselves because we care so much about patients that we didn't want them sold snake oil. And this hype hope theme that came through this article is that we didn't want them sold something that didn't work or that was going to cause them harm. But I think the data's in now, and umbilical cord blood certainly does produce a result in those younger children for improving movement. And it's up to us to, I guess, look at the data and make evidence-based decisions about moving forward with that. And it will be surprising, I think, to many clinicians that isn't what they expected to hear, although maybe some of them have known it was coming. So it's but if you think about mobile phones, when I grew up in a rural town in Australia, you squirreled with a little dial and you talk to the operator. And now we're recording this podcast on my iPhone that I carry with me, which is larger than the computer when my husband, who's an IT engineer, first worked on a first computer. So of course medicine is going to change. It's just about how we handle that change and how we embrace it. But what excites me about this is that it's safe, and a lot of things that are new have an uncomfortable safety profile. These things are safe because they're human cells, and our body knows how to deal with them. And the second thing is we are seeing positive results, and it's a low effort for families. And all of us that work closely with families just know how much effort and time they put into these things. So if they can get a good return from a small amount of time, then that's the sort of treatment people want to sign up to.
Absolutely.
I love that. It is incredibly exciting. And of course, you want to support it. And it aligns with the F word so beautifully in the sense that you don't have to spend all this time doing therapy if you can have this. And if it's an early childhood, they can have all those lovely early childhood experiences that you'd have to work so hard for. Remember when we had Dan Damiano on the podcast all about, she's like, you have to work so hard for this much change, but you can get it, but you've got to work so hard. And that's following all the evidence-based principles that we go by, let alone some of the things that are not so supported by evidence. You work so hard for it. And I just feel so much hope for where this is headed.
For sure. So Iona, a lot of allied health clinicians listen to this podcast, will be listening, I think, with great excitement to what we've covered today. I imagine they would be having conversations with families who might be looking into stem cell therapy and, trying to navigate their way through that. I wondered if you might be able to just give those clinicians out there a few kind of key take-home messages that they could feel confident to share with families when they're having those conversations.
So all stem cells have been shown to be safe for cerebral palsy. That's message number one. Number two, umbilical cord blood is the most researched. Over 800 children have had this approach, and we see that you get a large improvement in movement, particularly in younger children who are ambulant. And that's an exciting opportunity. It's not yet available in Australia, but I don't think it's that far away. It's certainly available off-label in the United States right now. So we're getting very, very close to a first approved stem cell treatment. And our country has great regulatory processes. We don't approve things that don't work. So, I think this has really been through all of the scientific processes. I'm a highly scientific person, but like to look for things that bring hope. And I think this is one where the science and the hope actually marries up with umbilical cord blood. If families are really thinking about other cell lines that they might be thinking about buying from commercial companies overseas, then I would encourage the clinician and the family to sort of wade through those important objective questions because some of those cell operators are more ethical than others, and we have to do no harm in this space. But I think that the times ahead are very promising.
Wow. Well, that was the perfect summary, the 60-second pitch to Ed. So we'll still go into the Tell It to Ed segment, but you might not have to summarize it again. Ed, let's roll into it. And I think you can go straight into a question if you're all right with that. So for everyone, Ed is our producer. He doesn't have a background in child health and certainly not in stem cell therapy, but he has most certainly been listening in on this conversation, probably taking notes. He is just recovering from some sort of respiratory thing, non-contagious, we're all fine in here. So his voice is a little bit off, but I think he's still going to be okay to ask a question. Ed, are you ready? Are you okay?
I am. I'm getting there. I'm getting there.
All right. Well, do you have a question for Iona?
Well, like many of the guests who do appear on the pod, I always have lots of questions, but constantly reminded I only have time for one. So I'm still going to sneak in two, though.
Oh, he's ready preempting it. Sheesh.
So, Professor Novak, I've been fascinated by this conversation, and I love that parallel of Botox and stem cells and working together for rehabilitation. And you touched on the three effects that stem cells could have: the anti-inflammatory, the repairing tissue, and my favourite one, the Hugh Jackman effect. And so I guess my question is about how do we know what kind of effect the stem cell has? And given that you said that it's very safe treatment, and there's a track record of 2,400 people, and that seems very, very impressive, is there a benefit to constantly trying stem cell treatment? And if so, what are the implications of this kind of behaviour with patients, and are there any downsides to that?
Great question, Ben. I feel like I'm talking more to Barry White with your voice there. It's great. So we've had 15 years of progress, 2,400 people treated, 4 major cells under investigation. If you were to have a neural stem cell transplant, we were to put them in the brain and with an aim for a cure, it's not yet available, but that would be a one-off treatment. If you were to use any other cells, so blood cells from umbilical cord blood, mesenchymal stem cells from joints and fat tissue. Those are circulating cells. And so we don't use an anti-rejection drug. And so you will clear the cells. And so it will be a temporary effect. And so we would think about repeat treatments. We don't have a lot of data. There is certainly studies that have shown it's been safe and efficacious on repeat dosing in small studies. It's really the next one that's begging to be done. It's complicated using blood products on repeat dose if they don't match well, because you're having lots of people's DNA. So we don't really know about that long term, but it's a next step. But we certainly know single doses are safe and effective of umbilical cord blood.
Wow. That was a good question, Ed.
Yeah.
Thank you.
Yeah, we didn't think to ask that
Even
one. That was
under
a good one.
duress.
I know,
Yeah.
exactly, exactly. Well, yeah, I feel like everyone can probably hear in our voices that we're very excited about this, and we're just really grateful to have Iona join us today. Look, we're going to obviously put links to this particular paper, and if we can get a hold of that patient handbook as well. So if you want that, I think let's make sure we make that available on our website, researchworks.net. And remember, of course, there's a CPD form there that you can fill out as well to keep this a part of your record of your PD requirements. But for now, I think we'll say goodbye. But we are going to be speaking to you again, I believe, because there's always new things that are coming, and you're a really reliable source of information. And I love your do no harm, which is it's the mandate for health professionals. I know it's in the medical, but you've also brought it into therapeutic land too, and I love that you've done that. But we will be coming to you to talk far more about the next steps.
Absolutely.
Yeah.
Thank you, Iona, and thank you for the way that you always manage to make science accessible and relatable to everyone. It's such a skill that you have, and I think we're all better off for it.
Yeah,
so
absolutely.
Thank you for your time, and thank you for everything you've taught us today.
Yeah. All right.
Thank you so
thanks,
much.
Iona.
It's such a pleasure to be part of your podcast.
Oh, thank you. All right, to everyone else, thank you again, and we'll talk to you all again really soon. Bye.
Bye.